Good day, everyone. I'm Taewan An. It's truly a pleasure to have the opportunity to meet with AMWC in Bangkok. A little bit of myself here. When it comes to nasal procedures, understanding the anatomy is important. There are a couple of areas in the nose that require careful consideration. You've got the nasal bone up here, upper lateral cartilage, and alar cartilage. Now, the upper lateral cartilage and nasal bone form a kind of snug space. It is fixed. So, when we're looking to lift the nasal tip, we need to work with the alar cartilage. Now, when it comes to using silicone implants, we typically place them in a way that compresses the alar cartilage. This can sometimes lead to issues like nostril deformities or even protrusions. That's why having a good grasp of the anatomy is crucial for these procedures. Again, the upper lateral cartilage and nasal bone are fixed in place, while the lower lateral cartilage can move more freely, kind of like an accordion. This understanding is important because it explains why thread procedures might not hold up as well as silicone implants in the long run. Threads can give you that temporary augmentation, but they tend to revert over time due to everyday face movements. On the other hand, with an L-shaped silicone implant, we're able to maintain that augmentation appearance for a good few years. However, it's worth noting that eventually the implant may erode and cause some protrusion. So, it's crucial to keep this anatomical structure in mind when planning and executing procedures. The nasal bone is positioned like this, with the upper lateral cartilage below it and the alar cartilage situated here. So there have been cases where the thread inserted ended up coming out of the throat. What happens is that the thread is inserted into this space between the nasal bone and the upper lateral cartilage. Then it travels into the nasal cavity. If you keep inserting without realizing, it can continue past the nasal cavity into the nasopharynx and even end up coming out from the back of the patient's throat. That's why we refer to this area as the rhenion and the upper part as the nathion. The rhenion area is the keystone area, slightly convex, so when inserting threads here, it's important to pinch with your fingers and create space upwards for insertion. Especially when dealing with patients who have a prominent hump, the same caution should be applied when inserting threads. Now, it's important to understand the blood supply as well. You see, we have the columellar artery supplying the nose, followed by the dorsal artery from the eye area. It's crucial to grasp the anatomical structure, both from the ICA above and the ECA below. So when doctors are enhancing nasolabial folds with fillers and accidentally block the lateral nasal artery, it can lead to skin necrosis in the alar area. That's why it's essential to remember that these blood vessels are ultimately housed within the SMAS layer, which lies quite close to the skin, particularly in the delicate nasal area. Therefore, when inserting fillers, it's safer to lightly touch the bone and gradually move upward. This cautious approach helps minimize risks. If the lateral nasal artery is damaged, this area could suffer necrosis. I've had several patients who required reconstruction due to this, especially for those who had rhinoplasty. If this area is cut during the procedure, the columellar artery is compromised. As a result, all blood supply is directed solely here, making it crucial to approach patients who had rhinoplasty with extra caution. If you watch this video, you'll understand it well. The morphological features of this thread can be summarized as follows: 16 threads in a mesh-type structure with a central void stent design. We've twisted 16 PDO threads into a mesh pattern to form the outer framework. This mesh design allows for even distribution of resistance against external pressure and promotes substantial collagen regeneration. Lastly, the central void serves a crucial role, providing a volumizing effect, withstands external pressure effectively, and stimulates collagen production, acting as a supportive framework. Like this. Anyway, now the distinctive feature of this new scaffold concept is that it has multiple side holes when viewed from the side, creating a unique structure with a central hollow. It's the only product designed this way, providing an environment where autogenous materials can grow. Once inserted, the body's own cells can penetrate, preventing migration, which is a significant advantage. Additionally, being made of PDO adds to its safety profile. Matrix contour now comes in two variations, hard and soft. Matrix consists of the following components. First, mesh-shaped threads. Second, L cannula. Third, white cap. The role of the white cap is as follows. You'd need to provide the details of the white cap's function. In general, if a thread is thick, it can fall out from the cannula while inserting it into the skin. The cap prevents this. When comparing matrix to other thread fillers like I-thread fillers, there's a notable difference in how they work. With I-thread fillers, multiple threads are contained within a single cannula, but when they're inserted into the skin, they tend to disperse, resulting in a scattered effect. In contrast, matrix, with its twisted structure, offers a more cohesive approach. This twisted design allows for a superior volume effect, providing more consistent and predictable results. As mentioned previously, we have two variations, hard and soft. The soft version is made with 7-OPDO, while the hard version is made with 6-OPDO, so the hard version offers slightly more resistance and has the advantage of providing a more significant volume-enhancing role. When comparing I-thread matrix to matrix contour, there are a few notable differences. Matrix contour offers thread lengths of 4 centimeters, 6 centimeters, and 8 centimeters, all made with 6-OPDO. On the other hand, matrix soft, with its 7-OPDO composition, tends to be slightly weaker in strength. The previous content was an explanation of contour. The structure of the threads is described in such a way that once you see it, you'll likely understand everything. Fillers typically have a gel-like consistency, making migration more likely. However, matrix is a solid material and structurally, migration is less likely to occur. This is a significant advantage of matrix. This can also be observed through these images, which show tissue staining after injecting filler and matrix. After filler injection, it quickly enters the tissue and forms space, but it also has the potential for fluidic deformation. In contrast, matrix remains in its initial position and steadily occupies the space due to autogenous tissue generation, providing greater stability. Immediately after the procedure, it provides volumizing effects, and over time, collagen regeneration further solidifies the space. In doing so, matrix offers many advantages compared to fillers. For experiments, matrix was inserted into the dorsal skin of rats, and histological changes were observed over time. After 1 to 2 months, it was observed that microvessels and type 1 and type 3 collagen began to appear around the threads. Let's look at how collagen regeneration varies depending on the number of threads inserted together. According to the research paper, when they inserted 3 types of threads and checked after 12 weeks, they found that inserting 16 threads led to more collagen regeneration compared to inserting 8 or 12 threads. Here's a photo taken 3 months after inserting 7-O matrix, 16 threads of 5-OPDO, and 1 thread of 2-OPDO into the subcutaneous tissue of mini pigs. In other threads, collagen synthesis occurs only around the periphery of the thread, but with matrix threads you can see that collagen has formed even within the stent structure. The first group consists of our product, matrix volumer, which is a stent-shaped structure woven with 16 threads, leaving the interior empty. The second group comprises a simple bundle of 16 multifilament threads with knots, not scaffolded. The third group consists of thick monofilament threads. Histological slides were obtained 3 months after inserting these 3 different thread materials into the subcutaneous layer of mini pigs. Matrix volumer showed significant differences in collagen generation and lifespan compared to the other 2 products. It accumulated numerous newly formed blood vessels and collagen both inside and outside the scaffold, forming more durable and compact collagen areas. The other 2 products only generated small amounts of collagen around the threads due to foreign body reaction, with no blood vessel formation. Eventually they formed scar tissue due to collagen degradation. In conclusion, matrix volumer demonstrates clear differentiation in collagen generation and longevity compared to other products. The summary of the experiments is as follows. During the 4-week period, collagen tissues containing newly formed blood vessels were created inside the scaffold. Initially, these collagen tissues were type 3, but by the 12th week, they had completely transformed into type 1, resulting in an overall thickening and toughening of the tissue generated by the scaffold. Additionally, the degradation of the PDO scaffold was observed starting from the 12th week. In conclusion, based on these two experiments, we believe that the tissue generated by matrix volumer will persist permanently. The procedure is very simple and straightforward. Using an 18-gauge needle or number 11 blade, make a puncture. Insert the matrix volumer cannula into the subcutaneous fat layer beneath the wrinkle after the puncture. It is very helpful for the procedure if the assistant maintains tension on the skin. Once the matrix volumer is accurately positioned in the treatment area, push the sponge holding the thread towards the handle, separate the thread first, and then remove the white cap at the back of the handle. Next, gently press the skin where the thread is inserted while removing the cannula so that the thread does not come out with the cannula. Afterwards, with the remaining thread outside the skin, firmly press the skin where the thread is inserted and cut off the remaining thread as if pushing the skin. Cutting the thread while firmly pressing the skin ensures that the thread remains safely inside the skin. The procedure is very simple and straightforward. We'll make sure to mention this part again in the procedural video. Place it beneath the dermis, below the epidermis, in this area. And this is regarding the reverse thread. So, back when I was a key doctor for N-Kogi product company, when you insert it like this, since there's a bump, it grabs onto it perfectly. That's why the position is precisely determined. But with matrix, since there are no bumps, the procedure method is slightly different. I'll explain it in the video. Let me talk while watching this. Here, I'm making a hole with an 18-gauge needle. The surgery I did today was for the nose, and I filmed it today. Since it's only about 6 minutes long, let's take a look. When I inserted it initially, it didn't catch well here, so it slipped out. I intentionally didn't remove it. Even after removing the cap and pressing, it still slipped out. So, when doing this, you need to press it well for it to be fixed securely. And because this person's skin is thick and there's a lot of soft tissue due to being obese, you have to firmly hold it like this to prevent it from slipping out. If you just do it normally, since there's no bump, it doesn't catch, and the thread slips out. Doing it this way, it doesn't slip out and stays in place. The procedure is the same as with other thread noses. I inserted about 4 threads. After doing this, when inserting it vertically, usually, there's a point called the ant, nasal spine. But now, inserting it around the ant, nasal spine usually, with threads that have bumps, you can just insert them. But these threads tend to slip out. So, based on my experience after inserting it on both sides of the ant, nasal spine, you need to press here firmly and then remove it so that the thread doesn't slip out. Normally it shouldn't come out here, so you should insert it like this in a straight line, but inserting it sideways like this, pressing the end here, and then removing it is what you should do. I think it's impossible to pull it like a cog thread nose here. In my opinion, after doing this, it would be good to supplement with some filler here to provide additional support, especially on the non-cartilage side. Let me take a look at what was inserted and remove it immediately. As you can see, usually I use Metzenbaum, but I used an iris scissors to dissect and find it. The thread is well placed under the SMAS layer, and the position is well secured once I inserted it. It didn't flow down too much after insertion, and the position, for example, if it had moved or come out to the tip of the nose, you should have seen the blue matrix contour right away, but that didn't happen. And earlier, there was a thin thread attached to the end of the contour, so I can guide it a bit. It's hard to find because the thread is well inserted. Usually, it's visible right away. I'm finding it here and removing it. It's well inserted, and there's a guide thread here, and here's the contour. So that's how I'm removing it. So it seems to have a good volumizing effect. If you look at what's inserted into the nose bridge, it's well inserted, that's all.